Welcome to another episode of HERcast with Dr. Chito, where we empower women to rise, thrive, and break barriers one conversation at a time. Unlocking her power, how health, empowerment, and inclusion fuel women's success is not just another conversation, it's a movement in action. Join us on this transformative episode as we sit down with the incredible Dr. Osasuyi Dirisu, Executive Director at the Policy Innovation Center and Senior Fellow at the Nigerian Economic Summit Group. With over 20 years of experience in shaping social development and gender policy, Dr. Dirisu has been at the forefront of groundbreaking initiatives that are changing lives. From leading the development of the National Gender-Based Violence Dashboard to convening the first National Gender and Inclusion Summit attended by thousands globally, her work is nothing short of revolutionary. She has dedicated her life to tackling the complex intersection of poverty, gender norms, and social inequality. And today, she's here to share her wisdom with you. In this episode, we'll dive deep into how health and empowerment and inclusion are actually the keys to unlocking the untapped potential of women everywhere. With a new blend of personal experience, global expertise, and actionable insights, Dr. Osasuyi will inspire you to break the barriers that hold women back and ignite the power within. Now, I'm going to ask a question. Are you ready to be inspired? Are you ready to learn how to take action and create real change? Then don't miss this episode because her success is our collective future. Stay tuned for insights that will challenge the status quo. Let's unlock her power together. Welcome, Dr. Dirisu, or I should say, Dr. Osasuyi. Yeah, I love the Osasuyi. Welcome to HERcast with Dr. Chito. I'm so excited about this.
Thank you so much for having me.
Thank you. You know, a lot of times we talk about gender inequalities, gender norms, social absence of social inclusion of women. And we find out that what really matters is changing the policy. We can speak, but the policies are not changed, then we may not see what we want. And this is where I think you focus a lot of your career in achieving. So I'm going to first of all just ask, how can we change the way society views women's health to empower women at every stage of life?
Thank you so much, Dr. Chito. Thanks once again for having
me.
Yeah. So when we talk about changing how society views women's health, we first have to just change how society views women. And that's really where the whole conversation about norms come from. So we are socialized to think about women in a certain way. So when it gets to that intersection where we're now reflecting on a woman's health, we bring all those perspectives into the room. So if we're going to see women differently, we first of all have to see them as people who have so much to contribute to society. Then we also have to understand their reproductive responsibilities, but understand their reproductive responsibilities as a foundational way of ensuring that society is sustained and we continue to build inclusion within the framework of what we do. But so going back to just thinking about women's health is pivotal for so many reasons. Women, have to get pregnant, have children, nurture those children, first of all, in childhood. Yes, with the support of their husbands and with the support of society. But understanding how all those caring responsibilities can, first of all, impact on her well-being, not just physical, but mental, the stress, the trauma, the juggling those responsibilities. For example, we're still trying to earn a living, contributing to society, how all those things impact on the worldview we put on women, and we still keep making demands of them. I always tell this very interesting story. In 2000, when I was doing my youth service in a hospital in Ebonyi State, and we had been going around campaigning for farmers to bring their wives to the hospital, just trying to reduce home births because that comes with a lot of complications. And there was this man who brought his wife in the morning, and this was her very first pregnancy. And then he said to me, he said, "Doctor, I'm bringing my wife because you people said I should bring her. but you really need to make sure that she has a baby quickly because there's so much to do. And so he comes back in the evening and his wife is still in labor because obviously there was some potential, it was her first, but we didn't think the labor was progressing and we're most likely going to do a cesarean section. And so he came back in the evening and was so upset. And he was like, that's why I didn't want to bring her. My mother had me on the farm, put me aside and continued working on the farm. You guys asking us to bring the women to the hospital is also making them become lazier.
Wow.
And I said,
wow.
I had to sit him down and really have a very hard conversation with him, before he kind of calmed down. And of course, we had to do a cesarean section. Mother and baby were fine. But it's really changing those perceptions about, first of all, sometimes you see people thinking about women as the weaker people. But then on the flip side, you're like, get this thing done, have the children, take care of them, go to work, come back, do so many things at the same time. So if we're going to really think differently about women's health, we first have to start to really take a closer look at the range of responsibilities women have and how we can work together as society to ensure that women have the support they need to juggle all the millions of things they have to do every day.
Very important. And how does including women in all areas of life, because as I said, health, but help them reach their full potential? Because, sometimes there was, when you work in the rural community sometimes and you're trying to, let's say, help women to reach their full potential, they're their own limiting factor. The mindset we talk about too is the mindset of women, that women actually hold sometimes similar mindset that men hold about them. So how can we tell them and let them understand that being included in all areas of life, be it health or social, financial, help themselves to reach their full potential?
So when we talk about women reaching their full potential, I always like to start from the business case. So first of all, getting us women to understand that our contribution to society or reaching our full potential goes beyond us. We have real roles, very real, valuable roles to play in society. And there's a lot of evidence about how contributing our roles at our highest potential can help to even ensure that GDP growth, economic development, is catalyzed. So it's first of all for us to see that we have a role to play. That role is critical in economic development. That role is critical in social development. That role is critical in fostering a gender-inclusive society. That role is also important in ensuring that we are shaping healthy futures for our children and generations coming after us. So it's first of all rethinking the fact that my full potential is not about me. It's about contributing to the bigger picture. When you look at, data around, loans, when you look at women take loans and repay at a higher rate than men, women contribute, very important conversations to a wide range of things. And the more we exclude women, the more we're limiting the potential for society to develop. I give an example about a dialogue I had to lead some years ago, and we're trying to look at the issue of female genital mutilation. And we reached out to critical stakeholders because we're trying to form a committee, and we're like, okay, send the representative who is going to be on that committee. And we had, when I got into the room that day, I found out that we had 18 people on this committee, 14 men and 4 women. And what was the topic? Female genital mutilation. And of course, you can guess what happened. The voices in the room did not understand the topic. And so they kept, dragging us back around some very critical conversations we're having about improving the well-being of women who had already been mutilated, but also working...
Which is also female circumcision.
Exactly, for those female circumcision, but also preventing more women from, getting caught in the future. So just understanding that being outside that table, when the decisions are being made, we are limiting our capacity to create healthier futures for our children.
And that's very important, because most people are on the committee based on where they are and what they're representing, where they're leading. So that comes into women being more in that position. So they'll be nominated for committees such as this. and not limiting themselves and pushing through the barriers as much as possible. Because that's what it relates to too. Even in the political climb, where there are more men making decisions over certain things, the women's voices in either the National Assembly or the Senate may not be heard with so much force than it should be because their numbers are so little. So putting women in places of leadership, I think, are very important in actually achieving these goals that we're talking about, or these good policies.
Yeah. And then just to add to that quickly, we're doing some work around women in economic leadership.
Yes.
And we also had a dialogue late last year. We brought young female economic students from universities across Nigeria, female academics, professors, and all that. There were some universities where students told us that all the lecturers in the economic department were male.
Oh, wow.
And so what that meant was there was no role model to keep them. And most of them said the reason why we cycle out, because this project was really around seeing how we can have that entire pathway of production of undergraduate economic female students all the way to becoming senior academics. And these young ladies were telling us that we don't have any role model. Who do you want me to look up to model me to become that future female professor in economics who would influence policy, shape economic growth or economic development in Nigeria? So, like you said, the more we are outside those rooms, or the more we are outside the spaces where, many times we wait until it's election time and we say, oh, we don't have enough women in parliament.
Yes.
But in all those other spaces, at the local government, in the office, in the administrative office, in the hospital, where we need to nurture female leadership, if we're not nurturing at that lower level, then we're never going to see them grow into those higher levels to achieve their full potential.
And that's a very great point, honestly. A lot of times, on TV, even in us that do like nonprofit work, you find out that there are a lot of people that are having what we call women health empowerment, women empowerment programs, and there's so many of those empowerment programs. But I don't know what the fraction is of those numbers actually make the right impact or understand what they're doing, because sometimes things trend. I'm empowering women, but how? And how is it making impact? What I'm saying, I use the word advice. What can you tell to people? Like, what can you tell us? How do you create a women's empowerment program that actually can make impact? I think how can, because people need to understand that it's just trending. Everybody has an empowerment program, and I think it's just not dashing them rice, shao. That kind of thing. There's maybe more to this. Do you know what I mean?
Yes.
What advice do you have about making an impactful empowerment program?
So I think one thing that is important is we need to think about empowerment as a long haul, not as a marathon. So not as some short, quick fix. So many times the reflection around empowerment is what can we give the women? So we can give them grinding machines, sewing machines. We're always just quickly thinking of, and then so we see all those pictures on TV where you see like an array of machines or implement, that we give to women, and then we take the pictures. The women are really happy. If someone very close to me some years ago did something like that, gave women, grinding machines, and, like a year after, I asked her, so have you gone back to see? And she made inquiries. A lot of them had broken down. Some sold them.
That one happens a lot. Exactly. They just wait and say, okay.
Yes, exactly. But just breaking it down, the first thing I always advise with thinking through empowerment programs is, what, first of all, do I need to fix in the woman? So that's where agency comes in.
Yes.
There's a certain level of understanding that the woman has to have, that self-awareness that I can actually, my hands can be productive. So I can get something to do and do it well. I can believe in myself, and my capacity to actually do this. We underestimate the power of agency, but it's critical. Then when we think about agency, then we solve for the skills that the woman needs. So what sort of skills? And it's not just only about, how to use this machine, but also in terms of personal skills, computational skills, financial literacy, savings. How does she organize herself? Some women are better doing this in groups, and we have a lot of evidence as to how empowering women in groups can
Yes.
work well, because they can also
I can
encourage
imagine
one
so.
another, leverage
Yes.
economies of scales, and do quite a lot together. And then finally, how do we provide ongoing support to ensure that after we've laid this foundation, then we can just be there to handhold these women and ensure that they take it off. And then, of course, providing opportunities for
Yes.
financing, loans. And that's why
Yes.
sometimes it's good to empower women in savings groups. I won't finish this conversation without highlighting the need to also ensure that our empowerment programs have some cultural competence.
Yes.
So you empower a woman, and we've seen that. I'm sorry, I have to use, some years ago, we're doing some work around just learning how decisions happen in the household when you've empowered women. And there was this man who said in one of the interviews that if an okra tree is growing taller than the owner, then you have to cut it down. And what he meant was to say, whatever empowerment you're bringing to my wife, make sure she doesn't become richer than me. And so just understanding how we carry the men along, the spouses, what that means for gender-based violence, what that means for the family dynamics and household decision-making is also a critical part of designing programs. So we don't design an empowerment program for a woman and prize her out of her home.
Yes. So I think these are very important things for people out there to hear, because it's not all that trends. You have to understand the components that make it successful, and also, like you said, cultural competence, so that at least they're happy.
Yes.
Because the idea of empowerment is not just wealth, right?
Yes.
It's also being contributed to your community in other ways, and being happy is part of it, and not being in a stressful environment. I think that I just had to bring that up, because I know that it's one of those things that always bother me about some programs. Like, have they done all their study elements? Do they understand how to make this make it sustainable, and make it actually impactful? So this is good for people to hear. Gender norms. How can we break down the gender norms that prevent women from getting the health care they need? That's a tough one, and it's still happening in 2025.
So when we think about, access to health care, the starting point is that understanding that it's a fundamental human right. So a woman has that right to access health care. Unfortunately, there are norms that may prevent that from happening, either as a result of the spectrum of gender-based violence, denial of resources. So I don't have the financial access to health services, so I can't go. And because of her cultural context, she's not empowered to have the money to access services. And unfortunately, we're still trying to have inclusive health financing schemes.
Remember the okra story?
Yes.
She can't become, so she has to.
Exactly. Yes. So in some cultures within our country, women still have to take permission before they can seek healthcare services from their spouses. And there's some aspects of healthcare access that a woman may face stigma for also wanting some services. So sometimes a woman wants family planning services. You may think it's as simple as just walk into the family planning clinic, but there are norms around family size, family spacing, type of contraception or family planning methods a woman can use, or child spacing methods a woman can use. There are norms around who takes the delivery. Is it a male nurse or a female nurse? There are norms around how our healthcare system is organized and how vulnerable women feel going into these settings.
Yes.
Unfortunately, norms are very difficult to change. So many times we're very quick to say we're going in here, we're going to provide education, shift the norms. They don't shift that easily. But one thing that helps is engagement. So how do we engage communities better, engage men better, engage women better? So there's that collective understanding that even if there's still these norms that create that barriers to access to services or decision making, we can get everyone to begin to understand that preserving a woman's life, ensuring she has access to services, there can be a consensus on the basic things. And on the basis of that consensus, then we can provide services that women need and remove some limiting barriers that help them access those services. And that's where women empowerment comes in.
Yeah.
Because a woman really should be financially empowered
Yes.
to also walk into a clinic and seek care without looking for someone to give her the funds to do that.
Oh,
yeah, I wish we
great.
had a functional health insurance
Yes.
program. But in the meantime, we need to still ensure that those limiting constraints are taken away so that women can feel better and have that agency to say, I don't feel well. I need to go and see a doctor. And this is an independent decision that she can make.
One time, because I know I adopted a primary health center in one of the suburbs in Abuja, and one of the things we started thinking of was this health insurance for women and children, or for those with disability. And the process is not that easy. Even if sometimes the agencies are willing to work with you, then it comes down to things like basic things like NIN number, and then you're trying to get them to get a NIN number, and they're saying, oh, the networks are down, and so there's a lot of bottlenecks that I feel that we should think about. Because sometimes I feel supporting communities with providing some way of insurance, even developing a community insurance, something, it's one of the key ways. Out-of-pocket expense for healthcare is too high in Nigeria, and it's limiting as well. But once they have that insurance, at least for the basic healthcare that they need, it will be a big deal. But most of them, I can tell you, most of the people don't even know anything about health insurance. You understand? And most of them don't even know that the NIN number is not, some people say, that NIN number, they're going to track me. No, it's also for other basic things that you need. So the education needs to be, and then being able to do your NIN should be with ease.
I agree.
It should be with ease. There are bottlenecks that need to be looked at. So I really think that those are things that could help with this access to healthcare. Now, how has technology and data helped in the fight against gender-based violence? I know that I read about your work on the gender-based violence dashboard, and I just wanted to hear more about it and how you think it actually help in this fight against gender-based violence.
Yeah, thank you. I mean, technology is really helping as much as we enable it to help, even though we know there are a lot of other barriers to use. But I mean, one way technology helps is with reporting, just giving people a voice that they would ordinarily not have. So I know that in 2020, because of the COVID-19 pandemic, everyone was locked up at home. And at that time, I was at the Population Council, and one of the projects we're supporting on the Spotlight Initiative gave us that opportunity to do some data management work. And then boom, everyone was locked at home, and then the story started coming out.
Violence increased.
But even though we knew that this was happening, there was no real data to show. Many times when we think about, thinking about prevalence, we show the videos of people, complaining on social media and all that, but we needed to have data. And that was where all those conversations about, having this gender violence based violence dashboard came up. And really what we were trying to do then was just encourage bottom-up reporting into a central platform, such that we have NGOs doing very fantastic work across the country. What if there was a reporting system that ensured that across the country we could have people reporting, validating at the level of the state, because we have to verify the data is accurate, but bringing it into one platform so that decision makers can look at the platform and see clearly. So, for example, you have 50,000 people who have reported cases. How many of these cases that were reported are in the system? What about the perpetrators? What about access to justice? What types of gender-based violence, is happening? Is it denial of resources? Is it physical? Is it sexual? So, just having that opportunity to see the data now helps for decision making around how do we react, how do we respond, where do we need safe spaces, where do we need to provide some empowerment support, what sort of response is appropriate, and then what should that help, how does that inform a policy enabling environment. And you will see that it was during that period that a lot more states in Nigeria began to domesticate the VAP Acts, because there was the VAP Act is the violence against So there was a lot more awareness. Advocacy was better with data.
But I thought some states that adopted it have kind of modified it, or is it that they moved out of it? There was a discussion that many states have modified it or not following it.
Many
Yes.
times we find out that just having the policy is not enough.
Yes.
Adopting the policy is not enough.
Yes.
What's the roadmap now for ensuring that this policy that has been adopted by a state will now actually be utilized by the agencies and ministries who are responsible for implementing this policy or legislative act to ensure that it now has real implications or
Yes.
real impact in the lives of people? So we see that disconnect between adoption is just the first step. We celebrate it to say, oh, this state has adopted, but what next is the bigger question.
It's true. It's true. How can we? So we know you gave an example about the committee earlier about having like only 4 women on that committee, but how can we make sure women's voices are heard when creating these policies? And I'm biased a bit because I'm a gynecologist, so I'm always gearing towards health, women's health. And I'm not only biased because I'm a gynecologist, because globally women's health is put in the back burner, and we're still struggling to move it to the front as very important. So how can we make sure that women's voices are actually heard in these policies?
So, I mean, there's been a lot of advocacy in the last decade, I must say. So there's a lot more awareness at different levels of government about the need for participation of women and men, and bringing everybody, even also persons with disability, bringing everyone to the table when these conversations are made. So that's a good first step. And what that does now is people reflect on, oh, you're setting up this committee, how many women? So we see that conversation happening a lot more frequently. Like, oh, how many women? Just ensuring that there's that balance. Do we have persons with disability? But there are different layers of voices, which I want to quickly talk about. So is one to sit at the table representing women. Is another thing to have the agency to advocate for what would now be beneficial to women.
Yeah.
And that's where capacity building comes in for women who are in decision-making spaces or women who have platforms, to ensure that they also know the right questions to ask, or we know the right questions to ask. We have the data, we have the conversations, and we are able to clearly come to the table with evidence-driven opportunities to advocate for real change.
Yes.
A seat at the table is one, but also taking advantage of that seat at the table to have tangible outcomes is another thing we need to push for.
All right. When I just talked about women's health, I noticed, and we spoke about this when you spoke about this when we had the talk on menopause, but I noticed that when we focus a lot, and they always focus a lot, especially in Africa or in developing countries, is maternal health. Which is very important. Yeah. Safe delivery, postpartum, but they're completely the other part of women's health, which is gynecology, where you deal with menopause, changes in the body, even from puberty, different medical problems that affect women very much physically, mentally, socially. Because when a woman, for example, suffering from severe endometriosis or infertility or all these issues, they have a lot of impact on not only the woman, her family, her marriage, the community. It's hard for them to actually reach any potential while going through these kind of things. So when we're talking about healthcare, how do you think, or you might not have, but what's your opinion on how we can get the government to notice these things? We talked about how we want more policies on menopause, and that's another angle. So that really ties into all that I'm saying. How can we create these policies? Because we're talking about, but how do we do it? How do we approach it? What's the how behind it? How can we do this?
Yeah, so over the biggest focus, I agree, has been on maternal mortality, because it's the elephant in the room. We have statistics are very poor. And I think, unfortunately, sometimes it's like, let's quickly fix this, and then we can look at the big picture.
Yes.
Unfortunately, that still hasn't been fixed. So I agree absolutely, and that's why the menopause event was a good one, that we can't wait to fix this, because we have to fix the entire spectrum.
Yes.
So I think it will just start from, conversations we're having today. And I know that there have also been a lot more conversations about non-communicable disease spectrum.
Yes.
You know, many times we focus on,
Yes.
you know, communicable diseases, maternal mortality.
Mortality.
So begin to look at the soft issues, mental health, menopause. But I think that just like we have a lot of organizations that have been advocating for maternal, improved maternal well-being,
Yes.
and are still advocating, we now need to encourage a lot more advocacy in these other areas, because
Yes.
that's usually the starting point. Identify the problem, then define it clearly, which is what we are all now starting to do, looking at all the other neglected areas of women's health, and then start to just form that conversation and the evidence needed to put this as an agenda item on the table. So I think just like has been done for maternal health, we have to start to think about how to create agendas around other big pieces in women's health.
Definitely, definitely. Now, from the gender violence dashboard, so during COVID-19 pandemic, what have we learned in terms of, with what you gathered, with the data so far you've received, what have we learned in terms of women's safety in the future, women's healthcare and safety in the future? Looking at what you gathered, your data you gathered during the COVID pandemic.
So I think we learned a lot of lessons. I think one that we all learned was when a pandemic happens, then if we're not intentionally building our work as a country around creating gender equitable systems, then it will show, you know, the inequalities and the vulnerabilities will be more apparent when we have, you know, issues like a pandemic, or even now that, you know, we're having conversations about food security, for example, which is really a big thing now. You know, going to communities, you will see that, you know, there's a lot more malnutrition, you know, among children. What's the response? So I'm not saying that it doesn't affect everyone, you know, in a certain way, but you would see that the more vulnerable people in society will be even more affected. And so the way we have to look at it going forward is ensuring that we're programming for equity. So that way, you know, because what happened during the pandemic was we're all trying to survive. Let's get into the mainstream and get out of this. And then we started to see those cracks that showed us that some people who are more vulnerable than others, you know, will be more likely to face, you know, devastating consequences from the pandemic. So I think the learning is really building structures that ensure that all our responses as a country are gender equitable. And what equity does, it helps us to adjust and ensure that we are balancing for those who need, you know, greater response or who need more help, and ensuring that nobody is left behind in a response where it's survival of the fittest. You know, like you can imagine when you have a food bank or you're trying to get people to queue for food, it's the strongest people who will go in and get the food. So how do we create, you know, either through social protection or social investments, how do we create frameworks that ensure that we are doing and responding from that gender equitable lens?
Now, things like poverty, social inequality affect how women choose, or their women's health choices. How can we fix this? I know you mentioned some things already, but I don't know if I missed anything covered, but how can we fix that? Because that's, well, it's bigger now. I wonder how you're facing it now that the economy has become a little tougher. So you find out that women are really, and one example of one time I really saw how bad the economy is when we went to, there's a community that have people living with disabilities, women, children, men. And there's this, you know, church that did an outreach there and gave them wheelchairs and crutches. And I don't think it was up to 2 days they sold it.
Oh, wow.
You know, and he complained that when he went back there, many people have sold it because they said to them, look, we don't have food to feed. So it's better for them to be on the floor and then be able to feed their children. So when I heard this, I was like, oh, you know, because the mentality first is that you might make more money on your wheelchair or when you can move, the mobility, but they didn't see it that way. And I said, you know, sometimes I think one of the biggest things that can limit implementation of the policies is poverty, which is 70% or more, I don't know, so they say, no data changes, that are more living under the poverty level in Nigeria. And I think that may be worse than that number. But how we then are we able to fix this, to be able to even Because writing policy is one thing, implementing is the most important part of it. How can we fix this? What are your
Yeah.
ideas?
So, I mean, talking about poverty, it's a very complex
I
topic,
know.
very complex. And there's so many different, faces of this. So on one hand, you have productive communities that are no longer productive because of real insecurity problems. People have
Yes.
been
Killed.
displaced,
Yes.
taken out of their farms, taken out of their livelihoods. So that's one part of it. The other part of it is what we had talked about earlier, which is really thinking through what a long-term social investment program for a country like Nigeria, what frameworks, what models have worked, what's our unique example, and what can we do? So, for example, where you've handed out cash transfers, just like you talked about the
Yes.
wheelchair, people take the money, feed today, and then it's over.
Yes.
So, what about social investment opportunities to tie whatever giving or disbursements we're making to actually helping women and vulnerable groups to seek productive capital? So it's not always about, and I agree with you, we give you a wheelchair so you can move and then be financially independent. But that short-term gain, let me sell the wheelchair and then have enough money to feed today. Tomorrow I'm going to be hungry again, but I'll fix it when I get to tomorrow. So it's part of what I talked about, changing the mindsets, ensuring that people have that agency before we hand out things to them. In addressing poverty, we have to think deeply about what should success look like. What are things we need to put in place? What sort of and what we're seeing more is creating opportunities for self-entrepreneurship, maybe what would be more sustainable on the long term. And that's why savings groups are so powerful, or women affinity groups, where you put women in a group of 10 or 15, create this conversation around entrepreneurship, build the skills, then give them the minimum capital they need to start, follow them up and then have them, but some follow them up and then have them grow in a steady manner. That way the women have an understanding of what you're trying to do. You have their buy-in. They take ownership. So this is not about today. We've explained to them that we want to address very critical gaps in, your agency, having something to do. You have to keep aside this amount. These are some sanctions within your group if you don't do this. We've even seen women affinity groups coming up with some opportunities for saving for healthcare. Like, okay, we're saving for our delivery, this proportion of our profit and all that. So in rethinking poverty, because many times we just give out money and then we come back the next day
and they're back to where
they're back to where they're coming from.
It's almost like it's not about giving the fish, it's about teaching them how to catch the fish.
Yes.
Because that's what really sustains them through the process. The last time we met, I was doing our talk on menopause with Comfort Booth. There's something you spoke about where you were trying to encourage women to be a protector of their own health, manage their mental stress, and you're talking about even how they can develop themselves and why it's important that they do this. Can you share that with us today as well?
Okay.
So more women need to hear that part.
I think in general, rethinking our role as women, as Nigerian women that we are, but also within the society that we find ourselves. Sometimes you just arrive at life and then life happens.
Yes.
And then when life happens, you're not really able to coordinate your response. So you find yourself in this flight or fight mode. You wake up in the morning, go to work. I lived in Lagos for 8 years.
Oh, wow.
And that was how it felt to me, I jump up, get to work, pick my kids, come back, prepare for the next day. Sometimes you come back 11 p.m. But in 2010, I took a step back and said, no, I can't continue like this. So sometimes just getting to that point where you take a step back and do a SWOT analysis. So what are my strengths? What are my weaknesses? What are my opportunities? What is threatening my well-being? One of the things I did there, just as a practical example, was I said, as long as I live in Lagos, Saturdays have to be indoors, because if you've had a very crazy week, for example, you can't jump out 6 a.m. again on Saturday, attend meetings, parties, events, and then come back exhausted. So that's just a very, one-off example. But I'm just saying, now being intentional, for example, about a mental space. So how many friends do I need to have? What sort of what's an empowering friendship like? What's a mutually beneficial relationship with a friend like? What are some things I need to do to declutter myself? What are some expectations that society has put on me that I need to share? The type of shoe to wear, the type of bag, the type of, what am I spending my money on? Am I saving? Do I have savings? And this has nothing to do with so many times, how much I have. But it's about that intentionality that I want to be able to make decisions for tomorrow. And so if I have 100,000 naira today, I need to save some of it, irrespective of how many needs I have. Do I need to buy that next? I don't want to shake tables, but do I need to buy that next? Do I need to have that next hairdo or that next bracelet or ashoebi?
That's my thing.
Or ashoebi. What are some things I need to take out of my life? How am I intentionally raising my children to ensure that I'm shaping the future life I want to have, as a grandmother or something? For example, if I bring up entitled kids, that's going to put me under a lot more stress in the future. What of nature? Can I change my living room or my environment? 2 days ago, I have a very precious hibiscus flower plant in my house, and I just sat out 7:30 a.m. and watched the flower just blossom and come into that full beauty. And I just took a picture of it and I put it on my DP. And then a number of people kept chatting me up like, this was what you spent 45 minutes doing, just watching this. But it gave me so much joy. And the beauty of the yellow and the red. And I mean, you may laugh at me, but it really empowers me to have flowers in my home.
Yes, flowers are beautiful.
Yes. And, just really watching them, open up every morning is really exciting. But it's also, I found out that it helps me to also relieve stress, just taking the attention away from myself and turning that to nature. But it's really just about women understanding the need to think about ourselves, think about self-care, sometimes be selfish about ourselves and ensure that we're not just living for every single person except ourselves.
That's true. I mean, you talked about flower. My favorite thing is the butterfly.
Oh, wow.
And you see it on my logo, you see it everywhere.
Oh, wow.
And people keep asking me, why the butterfly? And I'm like, the butterfly, just with the story of the life cycle of the butterfly is amazing. Just like when I think of the ugly caterpillar that eventually emerges this most beautiful butterfly. It's my favorite thing. So I'm all about butterfly. So when you said the flower, I was like, trust me, anywhere they'll see the butterfly. What's you and this
butterfly?
Do you have any final message for women or for leadership or just society in general about how we can shift gender norms to a certain extent and at least be able to get women empowered for full inclusion, if possible? But
I think my word would be for women. I love women.
Women. For women.
Yes,
for women.
For women. I think one is we need to understand that we are very powerful people. We have a very critical role to play in society. Our voice is important. We can make our voice heard. We can create safe spaces to thrive. We can be the change that we want to see. We're a lot more powerful than we think. And we can work together to shape a better society. Of course, working with men, working with decision makers, working with policy makers, but just seeing ourselves as a lot more powerful than we sometimes think we are, and then just being that change that we want to see. And wherever we find ourselves in our spaces, also ensuring that we're lifting other women and ensuring that some people can find their space through our shadows.
Perfect. I think that's a perfect end to a very transformational conversation. A huge thank you to our incredible Dr. Osasuyi Dirisu for sharing her wisdom, passion, and vision for a more inclusive and empowered world for women. Your work is truly inspiring, I must say. When I read your bio, I said your work is truly inspiring, and we're so grateful for the impact you continue to make. Thank you for being part of this powerful conversation today.
It was a pleasure.
What you've done for some women out there is unlock the potential within them. And I hope that this inspires all women that listen to this program. So, as we wrap up today's episode, remember this: the power to change the world starts with empowering the women within it. Every step toward health, every move towards inclusion, and every act of empowerment is a step towards breaking barriers that have held women back for too long. You have the power to shape your future, to be the voice for the voiceless, and to spark the change we've all been waiting for. Let this conversation ignite something inside you. The belief that we can unlock the potential of every woman, that we'll see a world where health, equality, and empowerment are for everyone, everywhere. Watch now on YouTube, HERcast with Dr. Chito. Listen on your favorite podcast platform via Spotify, Apple, Google. Follow us at HERcast Podcast and at Dr. Chito N. Watch on TV, Rapid TV, Star Times, Channel 176, Saturdays 7 p.m. and Sundays 2 p.m. This is just the beginning, y'all. The movement starts with you. Until next time, remember, true strength comes from within. God bless.